the vaccine is really interesting because I think there is a lot of misinformation that is circulating in the kind of media around vaccine hesitancy, and this idea that, you know, all of the like migrant communities, BME communities are particularly hesitant to access the vaccine. And the thing that is so missing from the conversation is the reality of what we know from our members of Migrants Organise, which is actually where there is hesitancy, it's not really hesitancy based on, you know, conspiracy theories or myths. There is some of that, but that also exists amongst sort of white British people. But actually what it is and what isn't being reported on is that it comes from a deep and profound mistrust of the government. And that is, you know, particularly so because people are being told, well, you know, the rest of the NHS you might get charged for and your data might be shared with the Home Office. But with the vaccine, don't worry, the vaccine is special. You can get it without having that, without being afraid of that. And people are deeply, you know, mistrustful that the government, A, mean it, and B, they're sort of like, well, if, you know, why are they so desperate for me to get this vaccine, but not support me with any other health problem, not care about my health when it comes to any other, to anything else. And I think a lot of the vaccine hesitancy stuff just misses that. And so, you know, what we are hearing is people saying, again, that they fear immigration officials being in these vaccine centres that they're, and, you know, new vaccination sites that they're setting up, that the information is going to be shared between the vaccination, the groups who are running the vaccinations and the Home Office. And that's why they've had to set up all of these new systems really quickly. And there's also fear that in the longer term, that information will get shared somewhere down the line. There's also this, you know, the thing again that's missing from a lot of the so-called hesitancy discussion is the reality of the fact that people are being told that in order to get the vaccine, you have to register with a GP. And as you know, as mentioned before, and as many groups have raised, registering with a GP, if you are a migrant who doesn't have immigration status, who has precarious status, and even more broadly, if you are someone who is sort of racialized as a migrant, it can be extremely difficult because you face barriers where someone questions your entitlement to registering, even though that is not the national policy. You know, the policy is everyone should be able to register with a GP, but people get asked for proof of address, for ID, and this particularly happens to, you know, BME communities, to migrant communities, and once they're asked that, they won't come back. They won't try and re-register. We, however, also have experiences of even when community groups, charities like Migrants Organise and others support someone to register, write them letters to help them register with a GP, explaining their situations. There are GP practices that just refuse to do so, that like, you know, will come back and it becomes, you know, again, extremely difficult to register people in order to help them access the vaccine, and also, you know, all of the other added health benefits of registering with a GP. And it's sort of led to, you know, there are now different groups who are sort of working with NHS England and others to set up pop-up vaccination centres and sites. You know, we've been working with the Patients Not Passports network to sort of put pressure on and ask CCGs and local authorities and others involved in the rollout how they can ensure that people can access the vaccine safely without fearing that their data actually is going to be passed on. And you know, there are some who are using paper records, for example, to make sure that there is that, you know, you prevent that kind of data sharing happening. There are others who, you know, have the vaccination sites in trusted community centres, faith institutions, you know, and so on, which means that people feel safer to come forward, you know, in a space that they know. But you know, that all of that has been necessary, I think, speaks volumes to how that fundamental trust between you know, patients and the NHS has been eroded because of the hostile environment that exists in the NHS and across all different areas of society. And it's going to, you know, it's going to take more than the government announcing that this vaccine, this one time, is free and available for everybody, regardless of immigration status. Because if the rest of the NHS excludes people, charges migrants for healthcare, shares their data with the Home Office, people are not going to trust, the one small part of the system that's there to vaccinate them.